My name's Adrian Richards. I'm a plastic and reconstructive surgeon based here in the south of England. I work in Harley Street and also in Oxfordshire, Buckinghamshire and Northamptonshire. And I'm the founder and owner of Aurora Clinics, which is one of the largest plastic and cosmetic surgery providers in the south of England. I qualified in 1988. I initially did different jobs like bowel surgery, vascular surgery, which is blood vessels. I did eye surgery and a little bit of neurosurgery. So that's really my background. And then I first saw a plastic surgical operation. I was just asked to go and assist a plastic surgeon called Bill Norris, who was from Kent. And I sort of went along, not really knowing much about plastic surgery. I'd never seen a plastic surgical operation. And as soon as I saw what he did, he was a very good surgeon actually. And it was just a very simple operation. It was just a skin graft, which is the most basic plastic surgical operation. But what really impressed me was his attention to detail, how he really was careful about how the skin graft lay, each sort of stitch, his dressings, all of those things just really resonated with me. And from that moment on, I knew I wanted to be a plastic surgeon. I wrote a book on plastic surgery when I was doing my final examination from Oxford back in 1999. I then chose to go away to Australia and do some specialised sort of super training really, sort of fellowships they're called, in hand surgery and aesthetic surgery. And again, that was a bit of a moment for me when I first really encountered very high quality cosmetic surgery, that I realised that this is probably what I wanted to do, and it's the attention to detail that I really found attractive. I then started work as a consultant in Stoke Mandeville Hospital, which is a great place to work. It's a super specialised unit, specialising in burns and spinal units. So I specialised in general plastic surgery, that's burns, spinal injuries, skin cancer, hand surgery, breast reconstruction in Stoke Mandeville for 5 years. And then I was finding it increasingly difficult because I was doing quite a lot of cosmetic surgery, quite a lot of reconstructive surgery, and I found it very difficult to combine the two and do the two well. So I made the decision really to specialise more in cosmetic surgery. And interestingly, even in cosmetic surgery, many of the surgeons now specialise in different areas. So my special areas of expertise are really breast enlargement, breast reduction and breast uplift. Also a particular love is inverted nipple correction, which is very common, affects 1 in 10 women and causes an awful lot of distress to people who are affected. And many people don't realise it's very simple to correct. I also perform a lot of facelift procedures, particularly the short scar facelift, which is suitable for people really between 45 and 60, which is a real advance in improving the appearance of the face with really natural results and minimal scarring. I'm also very actively involved in Aurora Clinics. We're trying to recruit the very best surgeons to work with us so that anyone coming to Aurora Clinics will see the appropriate specialist, whether it be for liposuction, rhinoplasty. We can direct patients to the appropriate surgeon to make sure they get the best possible treatment. At Aurora Clinics, what we're really aiming to do is create the highest quality, friendly, approachable, confidential, professional plastic surgery for our patients. And it's very important to recognise that most patients who are considering plastic surgery or cosmetic surgery are not how they're depicted. They're not sort of super vain, unrealistic people. Most people who come and see me have got real problems, and really what we aim to do with all our videos and podcasts is provide the patients with as much true to life experience as possible so that they'll know exactly what they're getting into, know what the results are likely to be, and know what the possible things that could not go so well with the procedures. We've got to remember these are operations, these are procedures, things can go wrong, and we need to know and inform people honestly about the pros and cons of any treatment they're considering.